Singapore. Gotta get up. The Big Show on Kiss 92. Gotta get up.
Good morning and welcome to The Big Show and The Big Show TV. It is a Tuesday. We love Tuesdays because we're joined by Dr. Geraldine Tan, award-winning psychologist from the therapy room. Good morning, Gerry.
Good morning, Gerry.
Good morning, Dr. Gerry. Oh, yeah, before we get into you teaching us how to become beginner psychologists, we need to do one thing. We need to play our Kiss 92 mystery travel sound first. And I think, Dr. Gerry, I think you played this with us last week. Maybe you've changed your mind about what you think the sound is. We're going to play it again, and then you can hazard a guess about what you think the sound is, okay? All right, it's the same sound because no one has guessed it.
Same sound, huh?
Same sound.
How come nobody can get this?
Don't know. Okay, we're going to play it now.
Okay.
Okay. So far, people have guessed hand dryer inside a plane's toilet,
Yeah, that's not correct.
inside a coach, inside a bullet train, skydiving, waterfalls, blowhole, wind blowing on a mountain. All that is not correct.
Wow.
But we can give you some clues, okay? Dr. Gerry, listen up. It's not transport related, though it is travel related. It is not something you can do in Singapore. And all the current 12 guesses that have been guessed so far are all absolutely wrong and nowhere close.
Surprise, yeah.
So, Dr. Gerry, for no prize at all, what do you think the mystery travel sound is?
Skydiving.
No, I already guessed.
Kids cannot.
Guessed already. Yeah, you get to go again because you have no prize to win anyway.
Okay, come back to me.
Okay,
Your guess
all right.
first.
Okay, no, we don't do it.
I would have said, Gerry, for 7,000 Expedia rewards points, $7,000 worth of Expedia rewards points.
Yeah.
Guess.
Oh,
and if you get it correct,
change.
we will give you the $7,000 worth of Expedia.
You know what? Because we don't
But you
even
didn't
know.
dare do that.
No, I didn't dare do that.
No.
We don't even know what the answer is.
Yeah,
so
exactly.
even if you guessed it, we wouldn't know.
That's why.
Yeah. So, but skydiving is not it
Not it.
because it was guessed.
Not it. Oh,
No, it's
man.
not. Okay, we'll come back to you later.
Okay, Gerry, this morning we're talking about terminology, understanding some terminology when it comes to psychology, simplifying psychology.
Well, because a lot of people still have the confusion what psychology is, what psychologists do, and the weird terms that we use sometimes we confuse ourselves. So because so many people were asking, I thought, I've said it before, but I thought we'll have a session just dedicated to it, to talk about psychology. And psychologists, when to go to psychologists also, right? So first things first, what are psychologists, right? Psychologists are not medical doctors. So a lot of people confuse psychiatry and psychology. So psychiatrists are medical doctors that give you medication. They've gone to med school, so they can prescribe the medication. Psychologists cannot prescribe medication at all. So yes, it gets a bit confusing because overseas sometimes the psychiatrist can then not do psychiatry and do psychotherapy, so they can also give medication, right? So that's why it's confusing in Singapore. But in Singapore, when you hear psychologists, typically they are not medical doctors.
Are there any individuals that are two in one, both psychiatrists and psychologists?
There are. That's why it's confusing. So it's not very common in Singapore, but overseas, when the psychiatrists can go do psychotherapy and they are licensed psychotherapists, so people go to them for psychotherapy, but then realize, but you can give me medication too, because they have that degree in medicine.
So you guys are like the piano and the organ, in other words.
Yeah, that's what I was about to say.
Some people who learn how to play, from what I gather, learn how to play the piano, you can play the organ.
Yes.
But if you learn how to play the organ, you
cannot
don't
play the
necessarily
piano.
know how to
Not
play the
play the
piano.
Yes,
piano.
yes,
Right?
that's true. Yes.
Okay.
Yeah, because you watch
That's a
all
nice
these American sort of shows where they're all lying on the couch and they're being counseled and
Yeah,
all that,
yeah, yeah.
and at the end of it, they prescribe the medication. You know what I mean?
No.
So
So
that's why I get confused with it's like a psychologist slash psychiatrist.
So there are people who will go and see a psychologist and then see a psychiatrist.
Yes, or vice versa. So
Wow.
the
See whoever you
psychiatrist
want.
would then refer.
Yeah. See a psychiatrist for the medication, and then you see the psychologist because
for your mental health.
Yeah. In fact, the psychiatrist will be able to. Oh, anyway.
No, yeah,
no,
no,
you
that's why
see,
we're
that's the
confused.
thing.
See as
That's the
many,
thing.
just like you can join as many gyms as you want. You can see any,
Yeah.
but
Gym
hopefully-
instructor.
Okay, anyway.
Yeah.
The red card. Shalini's been showing us the red card from just now.
And we've all been waiting for you.
Yeah.
What? You ask her. She was flashing it at your head. Anyway, let's continue this conversation on The Big Show TV. We are speaking to Dr. Geraldine Tan from the therapy room.
Okay, Dr.
Yeah, like, actually, you
Gerry.
know what? Stick to one. Gerry, you would also advise people to stick to one psychologist or one psychiatrist, right? Don't have too many, right?
Okay, so the thing about the therapist and client relationship is always very personal because all of us have different personalities. So although sometimes you hear me on air or you watch the Facebook or the YouTube, you say, oh, okay, I want to go see Dr. Gerry, but you come here, I have a certain personality, you have a certain personality, it might not gel too well. And it's quite okay to then say, okay, I think I need someone else who is a bit gentler, a little bit less dramatic, a different sort of style. That's perfectly fine. So the psychiatrist and psychologist, and most of us, will not be offended if you say, oh, I think I need someone else. Yeah, we won't be, because I had quite a number of clients who say that I don't want to offend my therapist. I said, no, we won't be offended because you are trying to look out for your own mental well-being, and that's good. You're not saying you're going to stop therapy. You're saying that you're going to just try a different method, which is fine.
Gerry, I've got a question. We always talk about this, psychologists and their therapy. Psychologists are therapists. Does that mean a psychiatrist is not a therapist?
So they do. So it's so confusing, right? You have therapy, you have treatment, you have management. So many different words. So typically we say, so the psychologists are therapists, and we use it so interchangeably is because we use therapeutic methods.
Oh, okay.
So the psychiatrists use medication, right? So they don't use the theories. They don't use the therapeutic methods to then help the patients. But they do treatment. So they treat the diagnosis. They treat the problem. Yeah, but when you go to allied professionals that Singapore classifies us to be, we then do management. So there's a treatment plan. So we come up with a treatment plan, or the doctor comes up with a treatment plan, and we do the management.
You mentioned earlier it's very confusing. You mentioned earlier some psychiatrists more so overseas can do psychotherapy. Right?
Yes.
Is this the same as what psychologists do? Do psychologists also give psychotherapy?
Yes, these are one of our methods. So we do psychotherapy, we do cognitive behavioral therapy, we do EMDR, we can do
counseling. No, is it called counseling at all?
Counseling is a big umbrella. So under that big umbrella, we have different methods that we use, theoretical frameworks that we use.
Okay.
So with that in mind, do you have different types of psychologists?
So the different types of psychologists is slightly different. So if you're talking about theoretical framework, comes under the counseling work, comes under the clinical work. If we talk about different psychologists, we have counseling psychologists, we have educational psychologists. Educational psychologists are those that do your testing for your children, where they do testing for dyslexia, ADHD, autism. They come up with a treatment plan sometimes. They go into schools, they look at your students in the school environment. So you have educational psychologists and clinical psychologists. So the clinical psychologists work with different clinical disorders like schizophrenia, eating disorder, depression, anxiety, comes under that umbrella.
You know, not to sound like Glenn, but I think I have ADHD and OCD. Because when it comes to like simple things like even food, I have to make sure that everyone's got the exact amount of grains of rice, for example. When it comes to rice is I'm
know what you mean.
over-exaggerating
I know
for
what you're
rice.
saying, yeah.
When it comes to ADHD, like I'm doing something 1 minute and then 2 seconds later I'm off to do something else, and then 3 seconds later I'm off to do something else, and I forgot what I was meant to do in the first place. But I don't know, is that a simplified way of self-diagnosing myself?
We really should talk about that. Maybe we can talk about that later on, like self-diagnosis.
Okay, hold on. We're going back on air, okay?
Yes.
Kiss 92 traffic.
The first situation you have to look out for is on the PIE heading towards the airport. This is before Engneo Avenue. Please avoid lane 3. A vehicle has broken down there. Also on Dunnan Road towards the city. Right after Adam Road, avoid the left lane. An accident has been spotted. If you spot anything else while you're out, please let us know what it is by WhatsApping us to 8855-0920.
Welcome back to The Big Show and The Big Show TV. Our guest for today is award-winning psychologist from the therapy room, my Dr. Geraldine Tan, whom I'm still trying to see, actually, but I don't know, it's 2024. Actually, Jerry, why can't I see you? It's not really a conflict of interest.
Of course it is. She knows
It
you.
is a conflict of interest because I know you. So
Yeah, I know you, you know me, it's easier, right?
You know me, I know you. It makes it more difficult because there's emotional investment. So we cannot counsel our family members, relatives, our friends. We try not to do that. Yeah, I know Singapore is very small, but we try not to.
But I'm different. Why don't we just try? See whether it works out.
She can't be objective.
I'll wear my dark
Okay.
glasses, so
she won't recognize you.
Jerry.
Put a cap on.
so I'll seem like a different person.
No, but Jerry, is this part of the rules? So in other words, you are breaking official rules? If you were to, that's what I'm asking.
Is it a rule?
Is it an official rule that you cannot help Glenn, or is it just these unspoken guidelines that psychologists have?
So yes, so we have quite a number of guidelines. Although we don't fall under the medical council, we have what we call ethical considerations.
I'm unethical. by the way.
You are though.
we know.
Yes, you are. But Dr. Jerry isn't, so there's a problem there.
I think it would be quite interesting if you're my therapist.
No,
You'll be in for a good time.
Oh wow, you should be scared.
For a good time. Yeah. So actually, we would be quite scared because, not suggesting anything, but when we were studying, we were told a lot of stories about unethical, inappropriate behavior. So the unspoken rules or some of the rules is that we're not supposed to go out with our clients. So go out for a drink, go out for coffee,
Fraternize.
and many cases in the past, not overseas actually, when the you breach the client and therapist relationship, and you have dual relationship, things can happen. So you hear of psychologists sleeping with their clients.
Yeah.
which then complicates the whole therapeutic process. Yeah, and causes a lot of issues because we do see clients who may be delusional, or may have aggressive tendencies. So then the psychologist or the client cannot be safe anymore. So, in fact, we do have some cases in Singapore too. So that's something that we encourage the young ones not to do. So to keep that boundary for themselves.
But
Okay, I'll never ask you again,
I
then.
would lay the blame entirely on the medical professional, though. You know what I
Why?
mean? Because people come to you for help, and some of these people,
Yeah.
like she said, are delusional
Okay.
or have mental issues. I feel like it would be the fault of the psychologists,
No lah.
to
Yeah.
encourage something like that, because
We're all
they are-
humans after all.
No, but still, they are the ones who have to have the better judgment.
Of course. Yeah.
Rather than, in inverted commas, take advantage of the situation, because that to me would be taking
I
advantage.
I don't think anyone is taking advantage of the situation. Sometimes things just happen.
Yeah, but
It's
these patients that they see have issues, and
Sometimes,
Mm.
I mean, well, okay.
Okay, yeah,
Sometimes
alright.
that's attractive.
Oh, yeah, to some people, I guess.
Why
Yeah.
do you think women?
I need to fix you.
Why do women love bad boys?
That's true. That is true. Yeah, if you
know what I
look
mean?
at it that way.
Yeah, but whatever the case is, I won't ask you already because now I'm very clear. So I'd rather be your friend
Yeah.
than your patient,
Yes,
so to
Yeah.
speak.
Yeah.
for sure.
But not
Yeah.
patient. No, you don't use the word patient, right?
Clients.
Clients. Okay.
Clients. Okay.
Yes.
All right. Let's continue to talk to Gerry on the Big Show TV. It is 8:16.
Kiss 92 Time Check brought
Yeah, imagine if all of us were her clients, then we can't be like friends.
No, we can't
we
because
can't go out. But now we can.
And she will know our deepest, darkest secrets, which is not fair to put her in that position as well.
Yeah, exactly.
When she's sort of socializing with.
darkest
Of
secret.
course, that's
Yeah,
what
of course
you
she
go
will.
to
Because
psychologists for.
you'll open up,
Yeah.
right? And then when something happens in your personal life, how does she help you deal
She
with it?
can't
How does
be
she even deal with it?
objective.
I have
She
no
can't be a-
deepest, darkest secrets, unlike
you
you
don't.
guys.
You've got plenty.
Deepest, darkest secrets.
Yeah. But it is, I'm also very grateful for the friends that come into my center where they approach me and say, Gerry, can I see you? And I say, no, but you can see my colleagues. And I want to reassure those that come here, even though I know you come here, if we always maintain confidentiality so it doesn't go
course.
anywhere.
Is
Yeah.
there ever a situation where a person comes in, total stranger, right? And surely after treating them for 2 or 3 years, what happens if they become a friend? Do you then...
Get married.
No, do you then... Sorry, no. Do you transfer them to another psychologist
Because you're friends now?
because you're now friends?
So if you are friends, then we would not see. So if it crosses to that boundary,
Yeah.
then we would not see them, or
You would-
we
you-
You would stop seeing
there's
them.
a change in the relationship.
Right.
Yeah.
Who
Yeah.
makes that call though, Gerry? Who makes that call as in like, okay, we are now we seem to now be friends, so maybe it's not appropriate, for me to see you anymore. Is it the therapist?
So the therapist would then draw the boundary. Yeah.
So it lays on the therapist's responsibility, which is what I was
Correct,
saying before.
Correct. Yeah.
The
Yeah,
boundaries,
yeah.
yeah.
But we hardly do that. I'm not sure. So my other colleagues can always bounce in and chime in and share also. But we hardly do that. Yeah.
Okay.
Or we try not to do that.
Gerry, we've got a comment on our Facebook page that I think is quite interesting. Albert Tay says, there are of late GPs taking up psychology. Do you have any comments?
Wonderful that they do that, but they would be very clear whether what is their primary role. And in all honesty, it's not very lucrative to be a psychologist. Contrary to popular belief, the GP earns far more money.
I'm sure you're just being humble. I'm very sure.
From the 15-minute consult and the medication that he can sell, all those, they earn him far more money in an hour than a psychologist, because a psychologist will have to see you for an hour. If we do 1.5 hours or 2 hours, we're still charged by the hour, so it is not, so a lot of people find that it's such a glamour job and everything. No, it's not a glamour job.
You make it look glamorous.
Yeah, that's the thing.
Imposter
I
syndrome.
think all of you
Imposter syndrome.
and make the work look very exciting. Having said that, the work is very, very exciting. Psychology is something that is very fun, very exciting. I've been in it for 20 over years now, but it is very tiring. So I do want to let the young ones know. It sounds so sexy now, right? Like, mental health advocate, psychology, the in thing to go into. But it takes a lot of effort, it is quite draining sometimes.
What is your story, Dr. Gerry? Like, why did you become a psychologist? When did you, have that moment that you thought to yourself, okay, this is what I want to do for the rest of my career?
After I met her in school.
Sure, yeah. She's
you
like,
be quiet.
I need to look
take
after
credit
my
for
mental
everything.
health. Thank you, FD.
No, that was far before I met Glenn. So in secondary school, where all the teenage angst and everything, so my family is English speaking. I went to Dunman High School.
Which is Chinese speaking.
Okay.
Yeah.
Yeah, Dunman High School, very Chinese. So I think now it is not as Chinese, but in the past it was super, super, super Chinese. Everybody was speaking Chinese. I felt quite displaced, although I did choose the school. And friends were talking to their friends in Chinese, and then they would turn to me and speak to me in English. That was how bad it was.
Oh.
So I felt like a fish out of water, and there was also a lot of awareness, of the self, of different things. And I was very curious about different behaviors that we manifest, behaviors of other people. How come we make certain choices? So for us in school, we make certain choices, but then, on the other side of the fence, I see another group of teens who were in like short skirts, smoking, and we were like, okay. I was thinking to myself, how come they are making those choices? What informed their decision, right?
I like that, short skirts and smoking. She's like, have to have the short skirts.
Yeah.
Did you belong to that group?
I belong to the short skirt group for sure.
Okay, yeah.
Of course.
Yeah.
Can't you
Because,
tell?
you look like you belong to that group,
I've got nothing against them, but in school, okay, I must explain. I love short skirts too, but I got fat stubby legs, so cannot wear. But
What do you mean? No,
We've
you
seen
have
your
lovely
legs.
legs.
what do you mean? See my legs, anyways.
On stage, dancing and all that.
Yeah, that's right.
You have very, very slim legs.
I don't think so. But anyways, in school, we had to have our uniform below our knees.
Wow.
So that's why the differentiation came about. Like, we are here and we are in like this longer skirts and looking so dowdy,
Sounds
and
very
there you
communist.
are across.
What do you mean?
Who was across the road? Which school was across the road?
No, not a school.
Oh,
They
not a
was just
school, right?
outside, Yeah.
Oh,
yeah,
okay.
yeah.
I thought you another school.
Your skirt was supposed to be the same length
No,
as
never
Gerry's
below.
skirt.
No,
It's
never
just
below
that
the knee. It was always
you were in
above the
convent, is
knee.
it?
I was in convent.
Yeah,
and
Just above the knee.
just above, never below.
just above
Convent
the knee.
girls will always pull it up.
Oh, yeah, of course.
Yeah, because we had the
Because you had the
ability
pinafore,
with the belt.
easy
yeah.
with the belt. Easy
Yeah,
to pull.
exactly.
Didn't need to sew anything.
You girls were just a bit more rebellious.
Even I taught my
Gerry
children
is
how
a
to
good
do that.
girl.
No, but
at
I
Dunman
had
High.
Oh,
never
no,
heard of
I-
below the knee skirts.
Yeah.
Never heard of that. Yeah.
Yeah.
No, but Gerry, I
don't
do
know
wanna
whether
say-
they still do that.
Yeah, I do want to say something though. Just now, you said you wanted to tell the young that it's not a glamorous profession, whatever, but it is very fashionable to get into mental well-being. My personal
Yes.
belief is it is a beautiful occupation, because imagine spending your entire life
Helping people.
helping people. That in itself is a beautiful occupation.
You know, the luckiest person in the world, your husband.
he doesn't quite indulge me in my work, but he indulges me in other areas.
You had to react like that,
Yes,
right? You had
right.
to make.
Yeah, no, I didn't do anything.
Oh.
I don't know where the conversation is
No,
going.
neither I.
Okay. Let's continue to talk to Gerry on the Big Show TV. We are on the Big Show
Yes,
TV right
that's
now.
right.
We're about
On
to go
air.
on air now. Sorry. Which is good
Yes.
that we're talking about all that on the Big Show
That's
TV.
right.
I thought we were on air.
No.
So I'm like, wow, we've been speaking on air for quite a while now. No? How is it Shalini hasn't thrown something at us?
At you.
Again, see? It's always me, but
It is-
actually she's always looking at Angel,
No,
always
no,
looking at
it's
the
always-
back of FD's head.
See,
Yes.
now she
or at
looks,
the side.
that's
Okay.
you.
Okay, okay.
But anyways, we all help people differently.
Roma, Roma, ma, ga, ga, ooh la la, wild y'all about romance.
Kiss 92 traffic.
Jasmine Soko's favorite.
Lady Gaga,
Lady
that's
Gaga.
right. If you're traveling down the ECP heading towards the airport, look out before the Fort Road exit and avoid lane 5. An obstacle has been spotted. Not quite sure what was left behind on the road. On the PIE towards the airport after the BKE, avoid the rightmost lane. An accident has been reported. And on the SLE towards the CTE after the Mandai Avenue exit, watch out for a broken down vehicle. Wherever you are today, stay safe.
Welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Geraldine Tan from the therapy room. You know, I've always wanted to ask you, Gerry, these days, right, when it comes to mental well-being and stuff like that, right, are you seeing more adults or more
Children, younger
Younger people.
teens?
Teens.
Or younger
Teens or
people,
kid-
yeah.
young youth.
More adults or more youth?
We've seen an increase across the different age group.
Okay.
So in my practice, I see the whole developmental spectrum. So I'm not that specialized into one particular disorder, but I see the whole spectrum, different age groups. So across the different age groups, there has been an increase, but the most heartening increase are two groups of people. One, the seniors who are coming forward.
The oldies but goodies.
Yeah, they start to understand what psychology is. They understand what the counseling is for. They are not saying it's for crazy people. So I'm really, really glad that they're coming forward. The other group are the men who are coming forward themselves, where they say, I think I have an issue. I think, it's affecting my marriage, so therefore I'm coming. Or I have anxiety issues. They start to recognize that it is okay, it is not weak to come in for a session. So that's actually quite lovely to see.
Yeah.
So when you say there's an increase across the board, is it a big increase of people coming in? Does that mean that there are more people who are facing mental issues, or it's just that more people don't see it so much as a taboo subject anymore? Do you know what I mean? Have the problems always been there, but not necessarily addressed?
Yeah, so you have a portion that the problems have always been there, and now they are willing to come forward, or rather not willing, they know who to go to now. So that's that part of the awareness and the education. They have a resource to go to.
Do you think
Yeah.
for many people it's a cost issue? Wait, why is there a red card now?
Because we have to go
Because
back
it's
onto
time.
the Big Show TV.
Oh,
We've been talking too long.
have
She
we
said.
been talking
I
that
don't
long?
know. I'm not
Alright.
sure.
Oh,
Yeah, she said so.
Okay, all right.
Hold on, Jerry.
Okay, up next, Ellie Gatey. This is I'm Sorry on Kiss 92. It felt like 1 minute.
It didn't. Yeah.
Yeah.
No.
No,
she's like-
but Glenn, you did
It was 3 minutes.
you did bring up something that's very interesting. Is it a cost? Was that what you were
Cost
asking? Is it
issue.
a
Yes,
cost
because you
Yes.
know what? I'm thinking like, especially the older ones. Okay, I
Yes.
don't know. Maybe you as well, FD.
Wait,
Because
it stuck with me. It did.
You've never seen a psychologist or a psychiatrist
No,
before.
no.
So you can either go to a psych. Okay, most of the time it's a session at a time. It's not such. It's not.
What
was
is that?
Sorry.
It's not a.
FD.
Sorry.
Wow.
It's not like you need to sign a package or anything like that. But each session, could cost like a couple of $100
Yeah,
or
I was
or
going to
more.
ask, how much is it?
So I
Yeah.
think the seniors, for example, instead of paying that amount to go and see a psychiatrist or a psychologist, they're thinking to themselves, okay, maybe I can just work this out on my own.
Yeah.
I've been working this out on my own my entire life. So why should I see someone? Unlike someone like me, I would, if I have something, and you were asking, right, about like mental wellness and stuff like that. In the past, I think a lot of people would suck it up, right, Gerry? These days, like for example, for me, I would go and see a therapist straight away if I have something that is on my mind. I could easily talk to a friend,
Yeah.
but I would rather talk to a professional.
So you
that
wouldn't
is
have,
my attitude.
You wouldn't have done this 20 years ago or 30 years ago? You would have thought it was taboo for you as an alpha male to go to a therapist?
Not so much taboo. It's just that maybe just
Sort
not
it out.
educated enough
Okay.
about
Yeah.
this. But now, as a result of this, right, like talking to Gerry and everyone's coming out a little bit more
Yeah.
and saying, look, it's
It's okay.
perfectly
It's okay.
Yeah.
It's
to
okay.
speak to a professional.
And yet FD has never gone for one though.
No, and this is the thing. I agree totally with Glenn. It's only the time that I've spent with Gerry that's opened me up to the
Yeah.
possibility of seeing one. Before that, I always thought, if I went to, there's something wrong.
Yeah.
Yeah, there is something wrong.
No, but
There is something wrong.
but
Right, Gerry?
I've never looked at it as I'm doing something about a problem I have.
But for you, is it a cost thing? Not because you can't afford it, but because you don't want to spend the money?
No, it's not a cost thing for me. But I agree with Glenn that for a lot of the
It can be pricey.
senior people, it may be a bit pricey.
It's not even a question of pricey. It's just like,
Why
money.
should I spend
So
it?
much
money
money
I
I spend.
Exactly.
Why should I
So
spend
it's
it
not,
when I
it's
can
not
do it myself?
affordability.
Yeah.
It is why should I spend it?
Correct. So because it's so, for the seniors, it is so alien, such a foreign concept to them, right? They would ask, why should I spend the money? It's only talk. What can you do for me? So
Yeah.
medication, they get something. If you sit in a therapy session, you don't get anything except talk. So people don't know what is going on inside their minds when the therapy is going on, or the whole process is going on. So for the seniors, they don't want to part with the money because it is quite a pinch. So you have the perhaps low hundreds to about averagely about 300. Okay, there are some people that charge more per session per hour, so we tend to go by about 50 to 60-minute sessions. So that's how we charge. Most people don't charge by packages, but some colleagues do charge by packages. I don't go by that just because I don't want to tie anybody down.
Yeah, and I know time is time, but do the youth or the older people get subsidy or
about to ask, yeah.
or a different, is there anything that people can tap into to get, say, a grant or a subsidy from the government that you can go for therapy at a lower cost?
So
there
not
anything
at the
like
moment.
Okay.
Not at the moment, but the subsidized rates, the government is really rolling out in all the different polyclinics and the services, the psychological services. Insurance, I do hear, are also looking into it.
Oh, nice.
Some of the insurers or the more expensive insurance packages do have a part that they cover a bit for
Of
psychology.
mental wellness, right? Okay.
Yes, mental wellness. But not all the insurance packages would have that.
I just want to say I've spoken to psychiatrists and I've spoken to psychologists, and I love it.
I've spoken to neither.
Love it.
Dr. Gerry, there's another question on our Facebook page which is interesting
Yes.
to me. It's from Cindy Faith. She says, how can parents try to get their teenagers to see a psychologist when they feel the teenager needs it?
Wow. Okay, teens are very, very tricky. So my question is, how come they're not going to the school counselor? Because the accessibility, and it is FOC, it is a service there that the schools provide, and we would want the students to utilize the resources. But many times it is difficult for them to use the service because they say, I don't want to look different from my friends.
I've got to say, even when I was in school, we had a counselor. And when I had problems...
Wait. During your time, there was a counselor in your school?
Yeah, we had a counselor in school. It was one of the teachers, admittedly. It wasn't a psychologist. But when I had problems, I wouldn't want to go because your peers would go, you go and see counselor. You know what I mean?
But I have a question about that. School counselors, are they actually
Qualified.
or trained? Because like FD said, it was one of the teachers.
Yeah.
Back in the day, no.
Back in the day,
But
I
now,
don't think so.
I'm talking about now because back in the day it doesn't exist anymore.
Yeah.
So
Yeah.
now are they qualified?
So they have different sort of qualifications. They are trained school, the counseling. So they usually now they should have a counseling degree or a psychology degree. Yes.
Okay.
So those that are called psychologists and is a licensed psychologist, we would have our masters. So at least a master's degree. And we would be registered with some registration. So for myself would be in the Singapore Register of Psychologists. Other colleagues would be Australia, the British the Register of Psychologists. Yeah, so we will have a license. Now what that means is that we before we can even register, we have 1,000 hours behind us supervised, and every year or every 2 years we need to renew our license. So it is that strict, so that we maintain that quality.
And when you say renew, does it mean you've got to go for an assessment yourself in order to continue to practice?
They assess you as well?
No, there's no assessment. There is a criteria for renewal. That means we have to constantly upgrade ourselves. We must partake in like workshops, seminars, conferences. So if we are supervisors, so for example, I am a supervisor, then I would need to ensure that I would update myself and to have continue supervisees that I supervise over the years in order to renew. So it's two different things. So not just the psychology, but also the supervision part of it.
Okay. Yes, FD, the red card went up. Nice check.
Yeah, I check.
Very
I
good.
don't check. I'm
Yeah,
checking.
finger like that. Finger like that. Yes, fingers up.
That's
Every
why-
time you're on, his fingers up like that. You know why? He wants free counseling
traffic.
sessions.
Wait, hold
That's
on,
why.
I want to
Traffic.
say something.
Hang
That's why
on.
my fingers up.
Kiss 92 traffic.
Okay, there is one situation on the KJE. This is heading towards the PIE after the Chua Chu Kang Drive exit. I'm not sure how many lanes the KJE has, but lanes 1, 2, and 3 are shut. Do avoid those lanes because an accident has been reported taking up lanes 1, 2, and 3. Once again, this is on the KJE towards the PIE after the Chua Chu Kang Drive exit. If you know what's going on there, please WhatsApp us 88550920.
Welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Geraldine Tan from the Therapy Room. I have to say, I really, really feel that psychologists like Dr. Gerry, right, they're so strong. Because, you know, they speak to messed up people on a daily basis. How do you not get messed up yourself?
Man, come on.
But you did say earlier, Dr. Jerry, that it's a very, like, you had a word for the youth that say psychology is cool and mental wellness advocates are cool and all that it's tiring. But you're not just talking about physical tiring. You're also saying it's very emotionally draining, right?
Emotionally draining. That's why a lot of my colleagues get jaded after a while because so one of my colleagues, who was in school or in the school environment, and you're with teens, and teens have existential issues and they have the suicidal ideation. You have to keep them safe. And it does take a toll on the psychologist herself, right? Herself or himself. And you feel responsible, and we never want to lose anyone, right?
Yeah.
So it is very painful for us. Not even the pain. When we lose someone, the person is gone. But when we are trying to keep
Someone
the
alive.
teens, in a positive or a neutral frame of mind, that weighs very heavily on us. Yeah, and where and I always say this: when someone passes, the family, the friends rally around the family, but nobody rallies around the therapist who have journeyed with the
person.
client that passed.
Oh.
Yeah.
Gerry, we've got a question from Debster on our Facebook page. She talks about psychiatrists, but I tend to think this may also sit with people who are thinking psychologist. After seeing a psychiatrist, and I'll add in, or psychologist, and knowing
Yes.
how to manage your problem, are there needs for regular follow-ups? Every 6 months, every 1 year, every 2 years? I don't know.
Like a parole officer, right? I mean, you check in, right?
Okay, you check
just to
in.
see.
Yeah.
So for those that feel that they've got their life together and they don't need to come to for intensive counseling, there are various ways we can do it, and I often encourage them to come twice a year. So I do have expatriates that come once a year for their annual checkup, and they really enjoy it. I really enjoy it, when they come and say, "Oh, I'm here for my annual checkup," and it's quite fun. But for many others who just want to sit and clear their doubts or download, twice a year would be quite comfortable.
Yeah, which is good. I mean, for people who feel very comfortable with Gerry and her therapist, right?
Yeah.
Anytime you feel like talking to someone, you can just go there. And I know for a fact Gerry has the best therapists at the therapy room.
Oh, thank you.
Seriously. So for anyone who feels like they want to talk to someone, and you're listening into Kiss 92 right now, know that, we've been talking to Gerry for the longest time now from a therapy room. If you need any help whatsoever, just look them up, okay? And I think therapists don't go, for example, "Oh, you need to see me again," or whatever. It's usually up to the client, right?
Yes, we leave it up to them. Yeah, but in private practice, there's nothing that is mandated. So you're free to come in, you're free to go. Yeah, it's
Okay.
voluntary.
Okay, let's
Yeah.
continue to talk
But
to
also-
Gerry. Oh, sorry. Go ahead. Sorry, I interrupted you.
No,
Go
no,
ahead.
no. I was going to say that there are different types of therapists we mentioned before, right? So you probably need to find out what your needs are and find out which is the appropriate therapist. So if you're going to up your game in an actual sport, go to a sports psychologist. You don't come to a counseling psychologist or clinical psychologist. If you're looking at something for your workspace, organizational psychologist would be who you would go to.
Oh.
Yeah.
Okay.
So there are
Wow.
many different psychologists.
All right, we've got a few more minutes with Dr. Geraldine Tan. If you have any questions whatsoever, please send your questions via our Facebook page, all right? Up next, Charlie Puth. This is Attention on Kiss 92.
All the great songs.
Okay.
Hey, Gerry, when
Yeah.
we see psychologists, one of two things can happen. You get a psychological assessment, or you get psychologically tested. What's the difference?
Okay. Yes. So assessment and testing. So I spoke about the educational psychologist doing the testing. So when you come to a psychologist and you have a consultation, the very first session we would do assessment, which just means we're doing a consultation. We're running through in our heads, the different signs and symptoms, anything that we need to look out for. Some of the colleagues may put you through a little bit of a survey, which is a very general survey. there's no report afterwards. It's only for their record purposes. So they would be doing an assessment. But that is our terminology. There is no report, because a lot of people will ask, can you write a memo for me for the session that we had? Can you write a report for me for the session that we have? We typically do not do that. Even if we do give you a survey. But when we do psychological testing, that means we administer a test, IQ test, with a battery of other tests, your attention test, your dyslexia test, your achievement test, then a report will be given to you, because you have then paid for that report to be given to you.
Okay.
Okay.
You were talking earlier, just before we came back onto the Big Show TV, about organizational psychology. What is
Yes.
that?
Organizational psychologists work with corporations, works with, let's say you want to select somebody for the leadership position, and they do a battery of tests for you to determine and profile the person.
Not like, okay, got it. So not like a career strategist that handles all that. It is to see hierarchy
This is
of the
Now,
organization.
see whether the person is also like suited for that position, right? Because on the outside, the person may look like, oh, he's all there,
Got it,
actually,
got
or
it.
she's all there, but actually deep
They're
down
not.
inside, a little bit psycho.
so Gerry. Technically, this is
Yeah.
profiling.
Yes. So they do a little bit. So we all do some sort of profiling, right? So you have your forensic psychologists. If you watch
that's
Criminal Minds and things like that, you would know that they do a different sort of profiling. They profile like serial killers or
Mine Hunters. You should watch Mine Hunters. Oh my gosh.
Yes,
Yeah.
yes. So an oxide deals with things in an organization. So organizational psychologists, they deal with things in an organization to see sometimes the team may be a little bit stuck, or there are some issues. So they come in to look at the different personalities, and what the manager can do or how to adjust certain things. Slightly different from what Adrian is doing as a career strategist. Yeah.
So they're kind of ad hoc people. They're not people that are within the organization. These organizational psychologists.
That's not true either, because for the larger MNCs, they do have in-house organizational psychologists who would then work with their organization, because it's big enough and there's enough people for them to work with. And they do the training, they do workshops for the organization also. Yeah.
Wow. Okay. Very cool.
That's amazing.
You know
I didn't
who's
even-
my organizational therapist, psychologist? Mr. Stephen Chu,
Oh,
Yeah.
who is coming into the studio in just a while.
you're such a suck up.
Nice.
You know me, lah. Just don't tell him.
Just trying to get points, Jerry.
Yeah, brownie points.
Of
man.
course.
All the time.
But don't tell him.
No, we won't. We'll try to keep it from him.
He would hear it anyway, so it's okay.
You think so?
Yes. Would be so much more interesting if he was actually here listening to.
He should be coming in very soon
Yes,
already
don't say
for
anything.
the Kiss 92 Mystery Travel Sound.
Yeah.
Okay.
Oh,
I am here.
okay.
Glenn.
Oh, he is
I forget
here.
the production room, and he just walked in, and
I'm hidden behind
Andre.
the lights.
oh my
There
goodness.
you go, Glenn.
Ayo.
Always
But I
shooting
didn't
your
say,
mouth out.
in all fairness, I didn't say anything bad about you.
No, yes.
Yeah. For
It's these
sucking
two.
up today, you get special.
I never
deal
suck up.
tomorrow.
Oh,
You
really?
get to come in 5 minutes late.
Oh.
Oh yeah.
Have I told you lately how good looking you are?
You come in 5 minutes late day after.
Okay.
I think you are the best boss I have ever worked under, Steve.
You come in 1 week later. Every day you get 10 minutes.
Wow.
Senior citizen discount.
Thanks, man. I'll go for that.
See, flattery will get you
Everywhere.
How true is that, Dr. Geraldine Tan? From a psychologist's point of view.
Flattery?
We've just seen it happen, but I don't know how it's gonna happen.
She's like, everything I've learned in psych school goes out the window now.
Okay.
You're quite funny.
Any more questions?
No, we're
about to wrap.
Everybody's. I've
On
asked
air, of
everybody's
course.
questions.
Okay,
yeah.
awesome.
It is lovely because because every time we ask the listeners, right, ask me anything, and nobody asks anything. Today, there's a lot of people that are asking
Yeah.
the questions.
Okay, wait,
So,
Dr. Jerry, we
very
can ask you a question. We can ask you a question.
Sure.
She just said a lot of people asking.
No, finish already.
Yeah, so
Yeah.
I'm
Done
done.
already,
I'm
Yeah.
done with
What living celebrity would you cry over if they passed away?
I
is our
heard
question.
you and I knew you asked me, so I was thinking very hard about it, but it's so difficult because I'm such a crybaby, right? So I cry, I cry at everything and anything. But I don't know. I think certain people will touch me. I mean, touch wood, everybody is healthy, but even the group here, if anything happens to any one of you, touch wood.
Oh my gosh. And I'm flying in a couple of days. Oh my god.
You had to ask, right? And
Yeah,
you belong
that's true.
to the celebrity
Yeah.
That's true.
category too. I tell you, I think I cannot stop crying.
Oh.
Aw.
Because
Now you're gonna make me cry.
I think if I go, you'll cry the most, I think.
Oh wow. Are we challenging? Now we gonna be competitive that way now?
No. She won't only
Always
cry.
competitive.
She won't only cry, bro. Every time she goes to work, she looks at her couch. She'll imagine you lying there.
Yeah. Even though you've never been
She's
there.
like, I should have seen him.
Should have taken the chance while I had it.
No. But I knew y'all were going to ask me. But anyways, yes, it was a lovely session today. I think there are still many, many questions that, people can ask. So ask away. We've got many more Tuesdays to go.
Okay, hold
Okay.
on. We're going to sign off on air, okay? Stand by.
Okay.
Tate McRae with Run for the Hills right here on Kiss 92. All the great songs in one place. It's Dr. Geraldine Tan from the therapy room.
Our
Good
boss
morning.
currently has his forehead in his palm. Good morning, Dr. Jerry. We've been talking about the definition of psychology, what psychologists do, how many different types there are. Do you have any sort of words to wrap this up?
Well, no, but I think the celebrity question was really nice. So I have a quote. Do I have a quote somewhere?
Do you?
I do,
A
but
celebrity
apparently-
quote, huh?
Celebrity quote.
No, not a celebrity quote. It's by Elizabeth Kubler-Ross, and she says, "The most beautiful people we have known are those who have known defeat, known suffering, known struggle, known loss, and have found their way out of the depths. These people have an appreciation, a sensitivity, an understanding of life that fills them with compassion, gentleness, and a deep, loving concern. Beautiful people do not just happen." So this is dedicated to each one of you.
I like that.
My
Beautiful
Thanks,
people
Gerry.
do not just
Well
happen.
done.
Especially FD, because he's been on this earth a lot longer. 68 years old this year. This year?
68? Wow.
68 years old. Can you imagine yourself at 68?
Who asked?
Yeah.
No. I'm already turning 50 and I'm like,
Right.
yeah, no.
50, you
I
say
know.
50.
Half a century.
50,
I cannot
54.
believe it.
Let me.
I cannot believe it.
68.
I know.
It's been said over and over again, and I just tell you that it's absolutely true. Age is just a number.
It is.
It's
It is.
all in your mind.
But I just cannot imagine
It's
that
all
we've
in your
been
mind.
on this earth for that amount of time. You know, you're like, where has the time gone?
Yeah.
Yeah, I believe for everybody else, but he's sitting down there. I'm sure he's aching all over.
So mean.
Somebody give me something to throw at him.
He's gonna need a cushion to sit on soon.
Enough already, both of you. Enough.
Thank you, Dr. Jerry. I'll see one of your therapists very soon again.
Okay, I'll see all of you.
Go and look for
Good
Dr.
evening.
Jerry's therapist or Dr. Jerry.
After
Yes.
working with the
Absolutely
two of you, I
amazing.
need a therapist.
All right, take care, Jerry.
Bye.
Bye.
All right, stand by. Coming up, headline news and sports, and we'll play once again Kiss 92's Mystery Travel Sound.